Hello, everyone. Welcome to today's video, where we'll be exploring one of the most important vaccines you may never have thought much about, the diphtheria vaccine. We're going to dive deep into what diphtheria is, why it's so dangerous, how the vaccine works, and why it's crucial for young and old to stay protected. We'll also take a look at the fascinating history behind the vaccine, who should get it, how often you need a booster, and of course, any potential side effects. So, let's get started. Diphtheria is a bacterial infection that was once feared across the world. Caused by the bacterium Corynebacterium diphtheria *, this disease was particularly deadly before the advent of modern medicine. Imagine living in the late 1800s. Diphtheria outbreaks would sweep through cities and towns, often claiming the lives of young children. The bacteria primarily attack the mucous membranes of the throat and nose, producing a thick, grayish membrane that can obstruct breathing. But it's not just the local infection that's dangerous. The real threat is the toxin released by the bacteria. This toxin can travel through the bloodstream, attacking the heart, nerves, and other organs. Without prompt treatment, diphtheria can lead to heart failure, paralysis, and even death. It's no exaggeration to say that diphtheria was a nightmare for parents in the past. The mortality rate for untreated diphtheria was incredibly high, up to 50% in some cases. This is why the development of the diphtheria vaccine was a game changer in public health. So, why exactly is diphtheria so dangerous? Well, let's break it down. The real danger lies in the toxin produced by the bacteria. This toxin damages vital tissues in the body, leading to severe complications. It can cause myocarditis, an inflammation of the heart muscle, leading to irregular heartbeats, heart failure, or even sudden death. The toxin can also affect the nerves, leading to paralysis sometimes of the respiratory muscles, which can be fatal if untreated. These are the reasons why diphtheria is considered a medical emergency and why vaccination is so crucial. While diphtheria is rare in countries with high vaccination rates, it remains a significant threat in parts of the world where vaccines are less accessible. This is why global vaccination efforts are so important, not just to protect ourselves, but to prevent outbreaks in vulnerable regions. The diphtheria vaccine is one of the triumphs of modern medicine. When you receive the vaccine, it introduces a tiny, harmless part of the diphtheria toxin known as a toxoid into your body. This toxoid is enough to stimulate your immune system without causing the disease. Your immune system then produces antibodies to fight this toxoid. These antibodies stay in your body, ready to respond if you ever encounter the real diphtheria toxin in the future. This is how vaccines prepare your body to fight infections by training it without putting you at risk. The diphtheria vaccine has a rich history. It was first developed in the early 1920s by French veterinarian and biologist Gaston Raymond. Before the vaccine, diphtheria was a leading cause of death among children in the United States and Europe. Raymond's breakthrough provided the first effective way to prevent the disease, and widespread vaccination soon followed. By the mid-20th century, diphtheria vaccination campaigns had dramatically reduced the incidence of the disease in many parts of the world. It's a powerful reminder of how vaccines can transform public health and save lives. Now that we understand the importance of the diphtheria vaccine, let's talk about who should get it. The answer: almost everyone. For infants, the diphtheria vaccine is part of the DTaP vaccine, which also protects against tetanus and pertussis whooping cough. This vaccine is given in a series of shots at 2, 4, 6, and 15 to 18 months, with a final booster between 4 and 6 years of age. As children grow older, they should receive a booster shot of Tdap, typically around age 11 or 12. This booster not only continues to protect against diphtheria, but also updates their immunity against tetanus and pertussis. It's also recommended that pregnant women receive the Tdap vaccine during each pregnancy. This helps protect newborns, who are particularly vulnerable to pertussis, before they're old enough to be vaccinated themselves. And let's not forget adults. Even if you were vaccinated as a child, you still need a booster shot every 10 years to maintain immunity. This is often done with the TD vaccine, or the Tdap vaccine, if you haven't had one as an adult. Staying up to date with your vaccinations helps protect not only yourself, but also those around you who might be more vulnerable. You might be wondering, why do we need boosters? The simple answer is that immunity from the diphtheria vaccine like many vaccines, can wane over time. To keep your immune system ready to fight diphtheria, you need a booster every 10 years. The booster shot reactivates your immune response, ensuring that your body can still recognize and combat the diphtheria toxin if it's ever exposed. This is particularly important for adults who might otherwise forget about vaccines once they're out of school. As we age, our immune system naturally weakens, which is why staying current with your booster shots is critical. It's a simple, quick step that can save lives yours and those around you. Now, let's talk about side effects. It's completely normal to be a little concerned about side effects when getting vaccinated, but the good news is that the diphtheria vaccine is very safe. Most people experience only mild reactions. The most common side effects include soreness or redness at the injection site, a low-grade fever, and mild fatigue. These symptoms usually go away within a couple of days. They're signs that your body is building protection, so while they may be a bit uncomfortable, they're actually a good thing. Serious side effects are very rare. In extremely rare cases, people might experience an allergic reaction. Symptoms of an allergic reaction can include difficulty breathing, swelling of the face or throat, or a rapid heartbeat. If you or someone you know experiences these symptoms after a vaccination, seek medical attention immediately. But again, these reactions are extremely uncommon. The benefits of getting vaccinated far outweigh the risks. Vaccination not only protects you but also helps protect those who cannot be vaccinated, such as newborns or individuals with certain medical conditions. It's a community effort that has helped eliminate diphtheria as a common threat in many